Just kidding. You look at your schedule and see who that is. But our next speaker is Dr. Natalie Hodge, and Dr. Hodge is really an amazingly talented person and someone that I've heard about long before we officially met this weekend. She is doing something kind of a little similar to what Stephen Knope is doing in the concierge medicine field. But what she's been able to do is integrate really interesting technologies, electronic medical records, and some innovative practice designs to provide innovation to clinicians who want to keep practicing clinical medicine but are just frustrated by the traditional ways that we're doing things. Dr. Hodge is really a leader in this field. She's trained as a pediatrician, and what she does now is she runs Personal Medicine, which is a website and also a practice model that you can integrate into your current clinical practice to see increased income, lowering your overhead, and really give better patient-centered care to your patients. So I'm going to go ahead and turn it over to her, but please welcome with me Dr. Natalie Hodge.
Thanks so much, everyone. I want to first give thanks to Stephen, and is he here, Stephen? He's hopped back onto the plane. I like to think of Stephen kind of as a Rosa Parks of our generation, in the sense that, you know, he was one of the docs that many years ago stood up and took a stand for himself, for his family, and for his patients to do something different. And I'm not sure if Stephen knows it yet, but what he has done is enabled docs like me and potentially a whole new generation of physicians coming into primary care practice and considering primary care as an option to be successful. And so thanks so much, Stephen, for that. I want to talk to you a little bit about innovation and technology, and then follow up a little bit about our business model, and take some questions from the crowd, and talk a little bit about legacy, because what I would like one of my legacies to be is to have PL-free residents across the country deciding, am I going to go into primary care? What are the comms? What can I make if I'm doing, you know, this specialty or that specialty? And I'd like for them to look at primary care and for them to have a viable business model to transition into that will be successful for their patients, for their careers, and for their families. So, what is innovation? I go to my trusty Wikipedia. A new way of doing something, or new stuff that is made useful. It can refer to incremental emergence or radical and revolutionary changes in thinking, products, processes, or organizations. So if you think of most of the innovation in healthcare, you know, when you go to conferences, it's all about, you know, getting this EMR and implementing a health IT portal, and these are little incremental changes, and incremental change is good, it's better than nothing. But these little incremental 10% changes that you can make in your practice to make things a little bit better for yourself. But I want to talk to you about not incremental change, but something else called disruptive innovation. Anybody know this guy? This is Clay Christensen, who has written a lot of books, but the healthcare book that he's written that's gotten attention of late. How many people have read Innovator's Prescription? It's a great book. This is Clay's vision for a new value network that will emerge over the next 5 years in healthcare. And so Clay has a variety of predictions. He says that the hospital model and the physician practice model within 5 years will be a much smaller piece of healthcare. And then Clay predicts 5 or 6 emerging business models, several of which you have heard about in this conference. Many are internet-based, membership-based, value networks for health, as opposed to, as Michael Moore refers it, sick care, fee-for-service, as we know now. And Clay feels like in 5 years, the payer system will not be at the centerpiece of healthcare. Does anybody know what Clay says will be at the center of healthcare within 5 years? The patient health record. So, PHR, and patients having control of their data. This is a gentleman, Frank Moss, who runs MIT's Media Lab, and I met Frank last fall at Mayo Clinic, and he allowed me to use this nice little curve. on disruptive innovation that he likes to speak about. And if you look at cost, of course, you see this is my little drawing, escalation of costs. And you know, there's lots of folks talking about reform. When you guys go to your professional organizations, you're always hearing about reform, reform. And we see that will bend the cost curve a little bit. But what helps create massive cost reductions is disruptive innovation. And so this is the kind of cost reductions that I want to talk to you about today. This is what you want to see in your practice. This is Steve Blank from Stanford, who has a methodology for startups and startup businesses, and we've touched on this a little bit during this conference, that a business is very simply a product or a service that a customer purchases. And so you're a seller of services, and you have people that purchase your services, and that in order to create a business model, you need to go out and talk to customers first. Another great book, if you're interested in entrepreneurship, is to read Steve's book, 4 Steps to the Epiphany. This is a little on lean development, a little more software. And so, what is value? We're always talking about value in healthcare, and what is customer value? Well, what would customers like? Let's take a show of hands. How many of you have had a house call, had a doctor come to your home in your life? 1, 2, 3, 4, 5 people. How many of you would like your doctor to come to your house and have house calls? Bigger group. Some of you don't care. The ones of you don't care. What are you guys doing? You're taking care of yourselves, because we're all docs. But so consumers want a lot of things. They want a better relationship with you. They want access to their data, and this is where consumer internet comes in, through community, content, blogs. This is a whole emerging business model now called Health 2.0. They want their access to their medical record, and they might like to have you come into the home. So how are you going to do all of that? Well, it requires process, improved business process. And so this is just a little exercise I like to think about called Who is Your Customer in private practice. And so Steve says the customer is the one who puts the money in your pocket. So think of your practices now, if you're self-employed, and who is it that puts the money in your pocket? Unless you're in a cash model like Steve discussed, it's the payer. And so what happens when the third-party payer is your customer? Well, that has consequences, right? Increased wage, shorter visits, larger physician groups, contracting, poor continuity, and contributes to disillusionment that we've been speaking about here over the last couple of days. And so average cost for running a primary care practice, and this is what my primary care practice cost the year that I left in 2004, $250,000 a year. And so in a disruptive cost curve, you're looking for cost reductions of 80%. So let's think about that for a little bit. Now, here's a 99213 visit. Here is everything that has to happen for you to get some money in your pocket, right? lot of stuff, a lot of people, software, more people, working claims. There's a lack of transparency, right? We don't really know what things cost in healthcare. And with all of this paperwork and scrutiny comes liability. And this is all for, you know, small ticket items here when you're in primary care. How many docs are primary care physicians? Very good. And so what's happened in